Very good morning, boys and girls. Hope you all are doing well. So, let's start with something new today. And you all had told me to take some MCQs related on calculations, isn't it? So, let us take certain MCQs related to calculations today. I'm your mentor at Unacademy, Dr. Reena Kaur. Okay? Yes. So let me tell you that calculation based MCQs are going to be um, very important, because you nowadays you see any type of examination is having calculation based MCQs. It could be your NEET PG, your INICT, but even if you look into the first MBBS के practical examination में भी we put one calculation based question. So this is important for everyone who's going to study physiology. And whenever I am teaching you on the platform, I always tell you that make a separate section, okay? Always make a separate section for only calculations. That means that is just going to reflect that this is the portion which will be consisting of only formulas. Like you will be having calculations in respiratory physiology, general, in kidney, then in CVS. So don't, if you make a file or a folder that is only having calculations, it will be very beneficial to you. So that is the portion where is only calculations are present. So let's get started with the first question for the day. If the concentration of sodium in the ECF is, right, the concentration of sodium in the ECF is 150 and that is in the ICF is 15, you are supposed to calculate the equilibrium potential for sodium. That is, I am asking you to calculate the Nernst potential. Yes. So anybody would like to try? What would be the correct answer? Yes, bachcho, anybody would like to try? Plus 10, plus 50, plus 60 or plus 70. So we are going to also find out that how are we supposed to calculate the Nernst potential even if any ion is given to us. Yes, so the correct answer is definitely plus 60. So how do I get this? You must know that Nernst potential is calculated as 61 log concentration of ion outside by inside. I have taken this as ECF by ICF, like this I have taken. So it is 150 by 15 and you know that the 150 by 15 when divided will be 10. We know that the log of 10 is 1. So 1 when multiplied by 61, you will get the answer 61 millivolts. Now let us make it more easy. What you can do, you always think that take the numerator and the denominator. So there is always a confusion. What should I take? Inside by outside, outside by inside, isn't it? So very easy, always take the numerator be the bigger number and the denominator be the smaller number, which makes our calculations easier. As far as the signs are concerned, plus sign is taken when the ion coming inside is positive and negative is taken when the ion coming inside is negative or a positive ion is moving outside. Right? So this answer becomes plus 60 because 150 by 15 ka log 10 which came to 1 and I multiplied it with 61. Next one. A group of third-year-old medical students are accompanied with a medical mission and they are going to mountain hiking at a remote mountain village and elevation would be 18,000 feet, right, with a barometric pressure of 380. What would be the resulting partial pressure of oxygen of the dry inspired air? You have to be very particular. Question asked is a dry inspired air, right? 160, 100, 80, 70 or 38? So who would like to make a try? Yes. So the correct answer is C, that is 80. Now how do we calculate this? See, this is based upon the Dalton's law. Dalton's law says that the partial pressure of gas is the product of the fractional composition of the gas and the total pressure of the gaseous mixture. That means here the oxygen we consider is 21%. You know, this is fixed. It will be multiplied by 760. But 760 will be the multiplication factor if we are considering the sea level. But here you are given that it is a hiking. So when there is hiking, that means a high altitude, that means the barometric pressure is going to decrease, which was given to us as 380. Right? It was given to us as 380. So therefore, we are going to multiply this 380 instead of, right. So we are going to multiply this 380. That means we are now going to get 21 by 100 into 380, and therefore our partial pressure of oxygen will come 80. If it is 21%, that is into 760, that is at sea level, it will be 160. But because we are moving at high altitude, there is a decrease in the barometric pressure. So we are going to multiply this factor by 380, and therefore we are getting less barometric pressure. Another important thing to be remembered, here the question was dry inspired air, right? The factor dry was given to us. Suppose if a factor humidified is given, for example, inspired air, humidified inspired air, then you must remember that you have got a partial pressure of water vapor, right? You have got the partial pressure of water vapor. This has to be subtracted, because when the air is humidified, it is going to be subjected to this humidification. That means at sea level, it will be 760 minus 47, or with whatever barometric pressure you are supposed to be calculating, you have to subtract 47 from it. So remember, you can calculate the oxygen, dry oxygen, you can calculate the oxygen of the inspired air. In that case, the humidification factor, that is partial pressure, has to be subtracted, right? So thus at sea level, if you have to calculate the humidified partial pressure of oxygen, it will be 21%, 760 minus 47. But if you are multiplying instead of 760, when we are moving at high altitude and it becomes 380, it will be 380 minus 47, and further it will be reduced. Next one. A 67-year-old man is a candidate for cardiac transplantation and undergoes cardiac catheterization to assess the hemodynamic status. In this subject, the findings are pulmonary artery pressure is 35, cardiac output is 4 liters per minute, and the left atrial pressure is 15 and the right atrial pressure is 10. You are supposed to calculate the resistance to venous return. Okay, it is the resistance or the peripheral venous resistance you have to calculate. Now, remember, you have already studied the Ohm's law. You've already studied the principle that Q is equal to delta P upon R. This is already known to you. So this basic principle is known to us, and anything can be a calculation factor. I may ask you to calculate blood flow or the pressure gradient or even the resistance. No. So what is the correct answer? Who would like to make a try before we come to the solution? Yes, the correct answer is C, that is 5. Now we know that this peripheral resistance is going to be delta P upon Q, because Q is equal to delta P upon R. This is the basic thing which we have learned, that Q is equal to delta P upon R, where this Q stands for blood flow, right? Delta P is the pressure gradient and R is the resistance. So I know that this R resistance will be delta P by Q. Now Q is the blood flow, that cardiac output which is given to us, that is 4. What is the problem is delta P. Remember, delta P is P1 minus P2. Now this has to be very nicely known to you, that which is going to be my P1 and which is going to be my P2, where you can make a mistake, because there could be many values which will be given in the problem, which may be of no use, just a confounding factor, just complicating and confusing. But if you are clear with your concepts, you will not make a mistake. So here it is the mean artery pressure. It is already given to us. The mean arterial pressure 35, right, minus 15. And what is 15? The left atrial pressure. That means here the right atrial pressure was given, but we are not supposed to include the right atrial pressure, because here we are speaking of the hemodynamics and it is regarding the pulmonary circulation. So it is 35 minus 15, which becomes my delta P, and the blood flow is 4. This comes to 5 mmHg per liter per minute. Again, please concentrate over the unit. Many a times the answer may be right, but you may make a silly mistake with the unit, right? Now, a 32-year-old man is hospitalized with severe respiratory disease, having an aspiration pneumonia. Inhaled nitric oxide is administered and he is placed in a prone position to improve his oxygenation. Values obtained after administration of nitric oxide are as follows, where we are getting the mean pulmonary capillary oxygen content as 19 ml per deciliter. Arterial oxygen content is 18 ml per deciliter, and the mixed venous oxygen content is 14 ml per deciliter with cardiac output of 6 liters per minute. And you are supposed to calculate the oxygen consumption. Normally, you know that whenever we use the Fick's principle, okay, it is with the Fick's principle, and usually the question is to calculate the cardiac output. And by Fick's principle, the cardiac output is oxygen consumption divided by atriovenous oxygen difference. So this is the basic Fick's principle, and normally we are supposed to calculate the cardiac output. But here the question is tilted. You are given cardiac output. You are also given arterial values and venous values, but you are supposed to calculate the oxygen consumption. So a same formula, but you can definitely get it in a different way. So the idea is that the concepts should be clean. So the correct answer is 240 ml per minute, and let's see how did we get this. We know by the Fick's principle, right, that we can calculate this as cardiac output. Okay, cardiac output into atriovenous oxygen difference. Cardiac output into atriovenous oxygen difference. Cardiac output is 6 liters per minute, which I can write as 6000 ml. Right, and atriovenous, so it becomes 18 minus 14, that is 240 ml per minute. So what is my 18 and what is my 14? 18 is arterial oxygen content, mixed venous content is 14. Again, this value, the mean capillary oxygen content, is given just to confuse you, and you may make it wrong, but remember we are supposed to take the arterial venous oxygen difference, which is 18 minus 14, right? Next one. What is the respiratory quotient in a 50 kg man who inspires 250 ml of oxygen and expires or gives out 200 ml of carbon dioxide? 0.6, 0.8, 1 or 1.25. Yes, something which is really easy but is a part of a calculation based question, so we need to know it. Who would like to make a correct answer? Yes, so the correct answer is B, that is 0.8, because we know that respiratory quotient, which is also called as the respiratory exchange ratio, is nothing but carbon dioxide produced divided by oxygen consumed. So carbon dioxide produced divided by oxygen consumed, that is 0.8. This is usually with the mixed diet. When the diet is having more of fats, it becomes 0.7. Remember, when we consider brain, the RQ of brain is 1. Why 1? Because the brain is basically glucose or depending upon carbohydrates for its nutrition. Now, the plasma colloid osmotic pressure is 25 mmHg. Hydrostatic pressure of the capillaries is 25. The venous hydrostatic pressure is 5. Arterial pressure is 80. Interstitial fluid hydrostatic pressure is -5 and the interstitial colloid osmotic pressure is 10. What is the capillary filtration coefficient is 10 ml per minute per mmHg. What is the net rate of fluid movement across the capillary wall? Again, you know, this is a very simple one. Again, you know that the net fluid movement is nothing but it is filtration coefficient into net filtration forces. Net filtration forces. Similarly, we calculated same for GFR. GFR is also filtration coefficient into net filtration forces, right? So this may normally which we get is calculation of either GFR you get, and यहाँ पर you have to calculate the net rate of the fluid movement, right? Filtration coefficient is given. Net filtration forces are not given directly. You've been given the values. So यहाँ पर you will have to first calculate the net filtration forces. You will have to calculate the net filtration forces. The value of filtration coefficient is given and you will then calculate the net movement of fluid. So the correct answer becomes D, and let us see how is it coming. So we must know that the filtration rate is capillary filtration coefficient into net filtration forces or the pressure. These are basically depending upon our Starling forces. That means the hydrostatic and the colloid osmotic forces, right? So it is PC, that is the hydrostatic pressure of the capillaries, minus pi C, that is colloidal osmotic pressure of the capillaries, plus pi I, that is the colloid osmotic pressure of the interstitial fluid, minus pi, that is the hydrostatic pressure of the interstitial fluid. All these values are given. You have to just put it. You will get this filtration forces as 15. Filtration coefficient is given 10, and therefore my filtration rate becomes 150 ml per minute. So instead of directly asking you, sometimes the questions can be tilted. I could have given you this value as 15 and make your work easier, but this also you were made to calculate. That means I am expecting that you should know this also, right? Next, if a patient has a creatinine clearance of 90 ml per minute, urine flow rate of 1 ml per minute, plasma potassium concentration of 4 and urine potassium concentration of 60, what is the potassium excretion, right? Now, the answer is very, very simple. Provided you know the exact formula, how do we calculate the excretory rate? So the excretory rate for any substance, not only potassium, is the urinary concentration of that substance into urine flow rate. Now again, यहाँ पर the creatinine clearance is given, but it is not required. It is just again a confounding or a complicating factor to misguide you, but it is not required, right? So the correct answer becomes A. So potassium excretion rate is, as I have told you, the potassium concentration which was given as 60 milliequivalents per liter into the urine flow rate which is given as 0.001 liters per minute. Therefore, the potassium excretion rate comes to 0.06 milliequivalents per liter. Remember, if you have to calculate the filtered load of any substance, it is again GFR into the प्लाज्मा कॉन्सेंट्रेशन ऑफ दैट सब्सटेंस। तो जैसे एक्सक्रीटरी के लिए आप लेते हो यूरिन फ्लो रेट एंड यूरिन कॉन्सेंट्रेशन, फिल्टर्ड लोड के लिए you can take GFR and the plasma concentration. These are one of the very important calculation based questions with renal physiology. Next. A 35-year-old man has got a vital capacity of 5 liters, a tidal volume of 0.5 liters, inspiratory capacity 3.5 liters, functional residual capacity 2.5. How much will be your ERV, that is expiratory reserve volume? Yes. So if you know the formulas, the answer is very simple. There is no confusion at all. The answer is E. How do I get? I know that expiratory reserve volume is vital capacity minus inspiratory capacity. How do I get this? See, vital capacity is inspiratory reserve volume plus expiratory reserve volume plus tidal volume. Inspiratory reserve volume, tidal volume, these together become inspiratory capacity. So vital capacity can also be written as inspiratory capacity plus expiratory reserve volume. Therefore, ERV will be vital capacity minus inspiratory capacity. So the vital capacity is 5, inspiratory capacity is 3.5. So it is 5 minus 3.5. Therefore, my answer becomes 1.5 liters. Got this? So again, not a very complex thing, but just a hidden formula. And again, lung volume and capacities, you know, are very important calculation based questions. Next one. Calculate the anion gap with the data that is given to us. What the data is given? pH 7.25, bicarbonate 12, partial pressure of carbon dioxide 28, plasma chloride 102, and plasma sodium is 142. So what is going to be the correct answer? It is A, that is 28, because I know that I can calculate this anion gap as sodium minus chloride minus bicarbonate. Okay, it is sodium minus chloride minus bicarbonate. So my sodium given is 142 minus 102 minus 28. This comes to, sorry, minus 12. So it is sodium minus chloride minus bicarbonate, that is 142 minus 102 minus 12, which comes to 28, right? So this is a very important one. You know that the normal anion gap is between 8 to 16 milliequivalents per liter. Anion gaps basically is the unmeasured anions. Next one. Right. A 30-year-old man having a weight of 70 kg with a sodium level of 120 milliequivalents per liter, calculate the sodium deficit. Again, there are fixed formulas for calculating sodium deficit, boys and girls, right? So the correct answer over here is C, that is 840. And how did I get? Sodium deficit can be calculated as 0.6 into body weight multiplied by desired sodium minus actual sodium. So this factor is constant. In males it is 0.6, whereas in females it is 0.5 into body weight, which was given 70. The actual sodium which should be there should be 140, right? The plasma sodium concentration in the ECF is 140. The actual sodium, that means the sodium which was given to us over here, is 120. So this becomes 140 minus 120, that is 20, and therefore the answer comes as 840. This similar question was in the last year NEET PG examination also. Now, a patient's urine is collected for 2 hours. The total volume is 600 ml, right, during this time. So in the 2-hour sample, it was 600 ml. The urine osmolarity is 150. That means definitely it is a reduced osmolarity. The plasma osmolarity is 300. What is the free water clearance of this patient? Plus 0.5, sorry, plus 5, plus 2.5, 0, minus 2.5, minus 5, it is in ml per minute. So free water clearance basically helps us to know that whether there is formation of a dilute urine or there is formation of a concentrated urine. So if it is a dilute urine, then the free water clearance becomes positive. That means a large volume of dilute urine, is passed by the person with a very less osmolarity. If it is a concentrated, it means a small volume of urine is formed by the patient which has got a high osmolarity, and it is a negative free water clearance. So you get a free water clearance positive can be in condition like ADH deficiency, diabetes insipidus, or suppose when we are exercising, there is lots of sweating. At that case, you can get a free water clearance negative, where all the water is reabsorbed. So the correct answer over here is a plus 2.5, and you can see that the osmolarity is also reduced. It is 150. But how do I calculate? Free water clearance can be calculated as urine flow rate minus the urinary osmolarity divided by the plasma osmolarity into urine flow rate, right? So you have got this, this factor, okay? It can also be said to be the osmolar clearance, isn't it? It is actually the osmolar clearance. This is osmolar clearance. So it is simply the urine flow rate minus clearance of osmoles, or the osmolar clearance. So I just apply this over here. You know that the urine volume, it was 600 ml per 2 hour. So you can take it either it as 5 ml per minute. Definitely this calculation will be required over here. And osmolar clearance, so you get a urine osmolarity divided by plasma osmolarity into urine flow rate. Everything is being provided to you. Urine osmolarity 150, plasma osmolarity 300, and therefore your clearance becomes plus 2.5. This means a large volume of dilute urine with a low osmolarity. So remember that if the urine osmolarity is less than the plasma osmolarity, it is free water clearance, which is positive. If the urine osmolarity is more than the plasma osmolarity, it is a free water clearance, which is negative. Again, this is a very, very important conceptual as well as calculation based question. So boys and girls, I hope today's session was useful to you. You could really understand what variety of questions which can be calculation can be in the part of your examination. So before I sign out, please look and check out these important dates by Unacademy. 19th Feb, which is the combat, you're provided with ortho, OBG, surgery and pediatrics. Unlock 20, you're getting 20% off, which is extended till 19th Feb. You can use the code REAP9. Sorry, you can use the code REAP9. Thank you, KSR. Please put in more ideas that which one you want me to take in near future for your, which topics you want more revision. You can tell me which topics you need more revision. The All India mock test is being on 26th Feb. The test series are there. You need to log the dates. You need to be very particular about this. And again, please look into the price subscriptions. You can again use the code REAP9 to avail further discounts. So we are also coming up with the comprehensive FMG batches, boys and girls, they are going to be extended short over a period of 4 months as well as long over a period of 9 months. So you can avail any of them, whichever you require. We are coming up with very interesting concept, that is a NEET PG revision, which is going to be all educator revision. Each and every educator is going to be on the platform to teach you. Right? So boys and girls, a happy learning to you and God bless you. Oh, Anusha, can you tell me which specific topic in CNS beta? Which specific topic? Because CNS is very, very wide. So which specific topic you want beta, so that I can be very, very specific in what to teach you. Right? So with this, boys and girls, have a happy day and thank you till we meet next time.